Okay, so just tell them your...
My name's Otto Roberts. I give Abby permission for a video.
Okay, so to do my trach suctioning, before I would walk into the room, I would knock on the door and just to make my presence known. Once I walk into the room, I would pull the curtain just to give my patient some privacy, and then I would wash my hands and then introduce myself. Hi, my name is Abby. I'm going to be your student nurse today. I'm just going to go ahead and just do a quick suction, couple passes of your trach, get those secretions out of there. It shouldn't take more than 10 minutes or so. Do you have any questions about the procedure?
No.
Okay. Can you confirm your name and date of birth for me?
Otto Roberts, February 19th, 1989.
Okay. And then I would check it against his wristband to make sure. Whenever I would go into the room, I would verify the orders to make sure I am doing the correct procedure on my patient. I'll go ahead and give you that. So what I would start by doing first, I already verified the patient's orders, and then I brought the patient's bed, if possible, to my hip level, and then I would bring him into a semi-Fowler's position. After I do that, I would listen to his lung sounds with my diaphragm. So go ahead and take a deep breath for me. Another one. Okay. Okay, so he has good lung sounds. Next, I have my tray all set up here. I would have normally a sterile table here to have all my equipment on, but I'm just going to use the edge of the bed for now. So I have my drape to go ahead and place over my patient, just so I don't get any of the secretions on the patient's clothing. So he's going to go ahead and be draped. Then I would go ahead, turn up his oxygen to do hyperoxygenation, just so, because he's not going to have his oxygen on him while I'm suctioning. So I'll hyperoxygenate him and then do 2 passes, and then go ahead and place the oxygen mask or the suction trach mask back on there so he can get his suction or oxygen. So what I'm going to do next is I would open my kit. Actually, I would go ahead, I have my goggles, so my safety eye protection, and then I have a mask. So if anything splatters on me, it will not get on my eye or in my mouth. Okay, so now I go ahead and open my kit. This is sterile, so I would open it away from me. This is my little saline basin. So I would open that up and set that there. My sterile gloves is actually on the bottom of it. So if I were to keep this sterile, before I would even open it, I would make sure that the sterile gloves is either on top or bottom. So to reverse, before this is even open, I would open it the other way. So I would open it this way, away from me. And then I have my sterile gloves. And you don't have any allergies to latex, do you?
No.
Okay. And you're experiencing any pain at the moment?
No.
Okay. So, saline. So my hands are sterile now. So I will go ahead and I have my suction here, and I will coil it in my dominant hand. And this will stay in my dominant hand. I would already have saline in my little bin there. With my non-dominant hand up here, I would change, turn on the regulator and then have it to 100 to 120. And then I would go ahead and have my suction tube connected to here, and then I'll have my suction on. So what I would do, if this is connected, I'll say that that's still connected. I can't touch this with my non-dominant hand anymore, so this is no longer sterile. So I can dip it in my saline about an inch and a half, and then since my trach mask is no longer on, I can go ahead and suction it. So what I do is I don't have my, I have this in my hand, and then I'll have my thumb close to it. So whenever I suction, I'll have it closed. But I can't get this hand close to the tip of this because this is sterile and this is no longer sterile. So I'll usually have like an inch or so that is no longer sterile. So what I do is I go ahead and fish it in there until I hear my patient gag, and then I have some resistance. So then I can go ahead and start slowly pulling it out and slowly, intermittently suction. And I wouldn't have this tube in the trach for more than 10 to 15 seconds. So then I would go ahead and take it out, and then I would do 2 passes. So as this is suctioning, it's going into a canister and collecting the secretions. And then again, it would go in there till the patient gags or coughs a little bit, or I meet resistance. And then again, just kind of bring it up. And then I am done with that. So I can go ahead and trash all of this. And then I would have my patients, I would put my patient's oxygen mask back on so he can get a good supply of oxygen again. After this is trashed, I would go ahead and wash my hands, and then I could take this off, the regulator's off, and that is it. I would wash my hands, thank my patient, and then I would walk out the door.